sure that those who are eligible for Medicare are able to access the health care. In our state, unfortunately, with the high healthcare costs that we have, we see reimbursement that simply doesn't allow for the level of access that is important in a high-cost state. So everything that we can do to reduce those costs, such as legislation that I've been helping to advance that would allow for greater access to Medicare recipients through telehealth, what we've done with the Medicare Empowerment Act to allow for those who are on Medicare to be able to select a provider of their choice. It's about access, and it's about working to reduce those costs through making sure that reimbursement is fair.
Medicare certainly does provide critical care for older Americans. It is very important to make the system sustainable, however. Right now, more money is coming out of the system than into the system. And one thing we could look at is taking an existing tax, which is an unearned income tax, and devoting that to Medicare itself. Another way we could make it more sustainable is to look at the actual levels of premiums that people pay, which seem to benefit the higher earners better than the lower earners. And those systems, I think, need to be adjusted to ensure that everyone has a fair shake. Medicare is vital. We need to keep it strong.
I've been really concerned with all the signs I've been seeing around Alaska with clinics and providers saying that they're not going to treat people over the age of 65 anymore. And that shows us how badly we need Medicare reform. I'd like to see more options for our seniors, like medical savings accounts and permanent telehealth coverage. And I'd like to see us give our providers not just tax deductions, but tax credits for seeing Medicare patients. That would open up more providers for us. And I think that any savings that we get in the Medicare program should be given back to help our beneficiaries and not rated to go plug holes over in Obamacare. Those are all options that would help our seniors.